Hi, I'm Dr. James Carr. I'm with Hospital for Special Surgery. I'm one of the orthopedic surgeon, sports medicine specialists there. I'm joined here today by Tim Teufel, former Mets player and current infield coordinator with the New York Mets. How are we doing today, Tim?
Doing great, Doc.
So we're here today at the Mets Fantasy Camp. Can you explain to us what the Fantasy Camp is and what your role is here?
Well, former players come into camp and we are the coaches. Most of the campers come from a variety of jobs. It's just a camp that allows them to put the uniform on to play baseball like the pros do. You see that pick? That pick was right on the money, man. And we try to teach them the different things that we've learned along the way. They love to yuck it up, and there's a lot of injuries here, Doc. We could use you.
So speaking of that, what are some of the common injuries that you see here at Fantasy Camp?
It's amazing. They come down and they're totally healthy, ready to go. The first day they usually do very well. They usually take batting practice, do some base running, run on the field, catch ground balls, catch some fly balls in the outfield and so forth. And they're feeling great until the next day. Now they got a little soreness, a little tightness, and then they play 2 games that day. By the second game, they're starting to get a little tight. And the following day is when the room is packed in the trainer's room, and the trainers are very, very busy. They're just not used to all the activity.
A lot of these participants are coming down from the tri-state area during the winter when it's cold, and they come down here and it's hot. What are some tips that you have as a former player and having run this camp for a while on how to prevent injuries and things and measures we can do to keep our body in tip-top shape when we're in an event like this?
Activity is key for them before they get here, whether it's treadmill, get on the bicycle, try to stay in shape a little bit with their legs. It's usually a leg problem because they haven't been doing a lot of exercise before they get down here. You've got the hamstrings, the quads, some calf strains and things like that. The big thing is stretching and hydration.
Absolutely.
You know, they need to get hydrated. The last day, usually the pros play against each team for 3 innings. So every camper has a chance to play against us. They get up at the plate, we pitch to them, we play the field. I could use a strength training coach at that point and a person stretching me out a little bit before the game happens. But it's a fun day for the campers. They really enjoy it, and to get a hit off of, like I say, a Dwight Gooden, it's a highlight of their whole camps. Try not to let them get too many hits though.
Fair enough, fair enough.
So Doc, when a person comes to you and says, "Hey, listen, I got some health issues," how do you handle it?
It really is assessing the whole patient and really just getting a sense of what their activity profile is, what they like to do, what they want to be able to do, maybe what they can't do because their body at the time won't allow them to do it because of an injury or maybe a part of their body is painful. And then it's really my job to really correctly diagnose them and then come up with a treatment plan that will allow them to not only rehabilitate back to their activity level and then get back to what they want to do, but then maintain that and become stronger and continue enjoying their sport without re-injury, because we see a lot of re-injuries when patients think they're okay and then they kind of abandon that routine that they should be sticking to. So it kind of goes back to what you were talking about, having that discipline and really just sticking to that routine that'll keep you healthy.
So Doc, after camp, can I call you for an appointment?
Absolutely, absolutely. We're always there for you.
Okay, appreciate that.
Perfect. Look at that.